Friends, I am Dr. Sujit Ghosh. Welcome to my channel, Dr. Ghosh Presents. Top 10 homeopathic remedies for teething problems of babies. Teething in children, though a physiological process, that is natural, gets often problematic. This video refers to those problems and how to solve those with the help of simple homeopathic remedies. What are common problems of teething babies? Number 1, dental caries. Top problem. It can be addressed by homeopathy nicely. Halitosis, that is bad breath in the mouth, also can be addressed by homeopathy nicely. Dental emergencies, that is some pain, inflammation, various other problem. Many of these can be addressed nicely by homeopathy. Gingivitis, inflammation of gum, disorders of gum, completely addressable by homeopathy. Orthodontic problem. Here lies it is outside the purview of homeopathy, because orthodontic means the misadjustment of teeth and jaw, or misalignment of teeth line, gum line, etc. So this will need some surgical intervention. As such, it is completely outside the purview of homeopathy. Excessive sucking of finger, completely under homeopathy. Grinding of teeth, same, completely under homeopathy. So most of the problem quite nicely addressable with simple medicines by homeopathy. How to address sore gum in babies during teething? Rub gently baby's gum. It can be done with the help of your finger, cleaned properly. Keep the gum cool. You can place a spoon after keeping it a few minutes in the fridge and place it in the gum. The gum will be soothed. Before bedtime, allow to suck a cool washcloth. For the same time, the sucking cool washcloth will give relief to the gum. Do some rocking and cuddling. That is completely psychological and mental effect of close hugging by the parent. That's an automatic thing. Relaxing warm bedtime bath. That is another very important thing. It can be given properly. Then the baby will go into sleep very nicely. Massage gum also. The massaging of gum is always important during teething problem. Anytime, massaging with the finger, with the washcloth, soft, clean, it can be done. When to consult a doctor during teething problem of a baby? If a baby is unable to eat, drink normally, the guardian must consult a doctor immediately. That is a very important thing. If the temperature of a baby runs high, though it is not associated with teething problem, yet a doctor must be consulted. Because normally, physiologically, there should not be any rise of temperature during teething. Generally, it is not. If it is there, then it may be due to some other reason, but that must be addressed properly. When to use calcarea carb? Calcarea carb for teething babies. 1 dose equal to 4 globules. It is written on the very onset, because with the 10 remedies, with each remedy I have mentioned the doses. So 1 dose means 4 globules in case of babies. Babies perspire too much. These are symptoms, sign symptoms. Babies perspire too much, particularly about the back of the head, wetting pillow. Almost all discharges, stool, urine, sweat, vomit, etc. from their bodies, sour smelling. Here I will just mention one thing. In homeopathy, we discuss about not only diseases but also the person. So the symptoms will be of that of persons and that of the disease also, both. And medicine is selected on the basis of both. And here the person symptoms, the general symptoms are more important than particular symptom, that is disease symptom. Mind it, this is a technique of homeopathy. So all discharge of stool, urine, sweat, vomit, sour smelling, this is the most important symptom of calcarea carb. If a patient of calcarea carb, you want to know whether the patient is calcarea carb or not, this is one of the symptoms by which you can say yes, he is a patient of calcarea carb. If it's so, then calcarea carb can be given to him or her on any circumstances. Homeopathy shows. Baby's fat, flabby, neat and clean. Fontanelles of scalp remain open long. Bony structure erroneous. Cannot walk timely. Do not want to place feet on ground. Fontanelles, picture one. These are the called fontanelles, where the cranium, that is skull or scalp, is made up of various species of bone. Now, where the bone unites, there are some gap remains at the time of birth. They are called fontanelles. And in case of this child, it remains open for a long time. Crustallactia. This is crustallactia, some sort of skin diseases, but it is not so much pain-giving or rather problematic. This is generally you can clear it if you try with warm water, etc. But it is there. It is a very common thing of teething babies or scalp. Doses 34 hourly, 1 dose for 2-3 days. If no result seen, after 6 to 7 days repeat. If still no result, or in old cases, give 200, that is potency 200. 1 dose in morning, empty stomach. Repeat after 3 days for 2 weeks. You see, medicines, homeopathic medicines are given depending on the situation, always depending on the situation. General situation is that you give medicine, wait for whether it is acting or not. If it is acting, then you may stop giving medicine. If it is not acting, you can give the same potency, you can increase the potency, because you can even change the medicine if your selection was wrong in previously. So many options are there. When to use calcarea fast for teething babies? Teeth erupt very slowly. Babies thin, fontanelle open. Bone of scalp very thin. Sound puch puch if pressed lightly. That is, if you press the scalp of the baby lightly, you will listen some sound. Puch puch, something is this type of sound will come. Cannot keep head erect. See this patient, he cannot keep his head erect. Abdomen slack, push in. Do not like to stand and walk. Like to suck breast milk always. This is calcarea fast, previous it was calcarea carb. You please note down the differences. These two are medicine are side by side. They are almost like brothers. On coughing, milk breast always. On coughing, rumbling of sound always. Rumbling means this is some gargling, rumbling sound in the windpipe or lung area due to some mucus. Dentition delayed. Suffer from greenish diarrhea. Baby is anemic, very weak. Doses follow the previous procedure just described. Number 3, when to use sulfur for teething babies? Anal oil is very much red. Babies like to keep bare-bodied. See how he enjoys. How the boy is enjoying his bare-bodiness. Like sweets, very much. Palms and feet hot to touch. Skin, hairs rough. Lips bright red. Stool acrid, feels raw when touches skin. It is a must for scrofulous child. Scrofulous child means child who has inherited tuberculosis by birth. That is, either parents, either father or mother, maybe a tubercular, or they are a tubercular from family, or they themselves have suffered from this disease. To eradicate scrofulous, diathesis is high potency to employ over long interval. That is to be followed later on, not now. Not this position. When the baby say will be about 1 or 2 years old, it can be done. This is most important. With the help of sulfur, the scrofulous disease can be eradicated completely. And if it is done, the baby will be relieved of too much, many troubles in his future life, in her future life. Number 4. When to use belladonna for teething babies? Face red, hot, skin dry, pupils dilated. Babies start up when sleep just sets in. Limbs jerk, twitch, convulsion is there. Pain comes suddenly, goes suddenly. While sleeping, tend to push head into the pillow. Doses 30, 4 hourly, 1 dose. This is a belladonna child. Number 5. When to use aconite for teething babies? Sudden attack of troubles. Skin dry, hot. Tendency to run temperature. Tendency to run high actually. Babies bite their own fists. This is a picture of aconite patient. They bite their own fists. Restless cry. They feel restless, they cry always. Cannot sleep, excited, restless. Convulsion during dentition. Constipation or black diarrhea. Doses, follow the procedure just before. That is in case of belladonna, the same. Number 6. When to use Zinca Met for teething babies? During dentition, brain trouble start. Babies cry out during sleep, face red and pale alternately, move head side to side in sleep, legs restless, continuously move legs, even in sleep too. Doses 30, 1 dose a day in morning for 2 days. Zinca is a slow but deep acting remedy. Do not use much, just wait to start its action. When to use chamomilla for teething babies? Children very much irritable, bite, grin, very anxious, restless, roll over bed. Pacified only when carried on arms. See, when carried, he is pacified. Sleepy but cannot sleep. Sweat all over in pain. One cheek red, hot, other pale and cold. Want this or that, but when given, throw them instantly. Greenish diarrhea in dentition. Odor of rotten eggs in stool. Abdomen swollen, colic. Doses 30, 4 hourly in a day. It's an acute remedy. If selected correctly, action so soon. Number 8. When to use creosote for teething babies? Gums very painful, red or bluish. Tooth erodes just after eruption. During dentition, constipation or diarrhea or cholera. Stool very obnoxious, profuse vomiting. Babies cannot sleep unless patted or caressed. Babies suffer a lot during dentition. Creosote babies suffer a lot, too much. Different types of disease may come in that period. Doses 34 hourly, not required more than 2 days. Nine. When to use Silicea for teething babies? Babies scrofulous. Scrofulous I have already mentioned. Persons who has inherited tuberculosis by birth. Suffer from worms, profuse salivation, abdomen hot, stiff, swollen. Constipation is there. Hard stool comes out partially, then again recedes back. Sweat on feet malodorous. In evening, much shower sweat on scalp. Babies with large head. Fontanelle is big. Not the fontanelle is the baby. Big fontanelle is. Vesicles over gum. If gum touched with fingers, babies turn their mouths. Doses 30 twice a day, 6 hourly. No more needed. If selected correctly, it will show action. It is very deep acting. No more doses are required. Mind this, Silicea is the topmost deep acting remedy in homeopathy. You may wonder during practice if you wait for the action of the disease. 1 to 100. I have given 1 to 100 patient of say suffering from piles, and that 200 acted for about 10 months in the particular person, and finally it was cured by that dose. But during this 10 months, symptoms comes and go, but I never interfere because I know Silesia is this type of medicine. You have to wait and watch. Even 130 dose may act as long as 4 or 5 months. Silesia is such a medicine. When to use colchicum for teething babies? Convulsion during dentition due to reflex action of abdominal complaints. Stool of babies are of varied types: pasty, liquid, sour smelling, acrid, etc. Trembling of body during sleep, jerking of body parts. Sometimes wake up from sleep experiencing frightful dreams. Grind teeth during sleep. Nod heads right to left over pillow. Doses 30, 4 times, 6 hourly. With this, the video ends. Thanks for listening and viewing. If you got any problem, please write down in the comment section. I'd certainly respond.